Hello, I'm Dr. Kate Murray. I'm an anaesthetic and intensive care consultant and I'm a clinical lead for Esearcher within the Trust. Just really want to tell you a little bit about this system, as it's probably the system that you'll use the most when you're working on the wards here as a junior doctor. It's a homegrown system. It was developed by one of our in-house software developers, a really great man called Paul Chandler, who's working within the Trust. And so it's a system that we can add to and take away from really on your feedback. It's a repository really for all the major data on your patients. So it pulls together all of your lab reports, so you'll find all of your pathology blood tests there. You'll find all correspondences there as well. So anybody who's been to outpatients and seen, say, the respiratory team, they'll have a letter in Esearcher. You can also get the results of significant investigations like echoes, and also you can access the PACS system through it. It's also really great for ordering tests and, most importantly, printing labels, which I discovered today. It's also used a lot clinically on the wards for handover. So how do I get into it? Well, there's two ways of getting into it. You can either use the icon on the desktop, which will almost certainly be available on every ward that you work on. Or alternatively, you can go through the Internet Explorer icon to get you to the Trust's website. And there you will find Esearcher has its own button on the top strip. You'll need to sign in order to ensure that you have sort of safe access.
Esearcher is where you're going to find all your patient data, all your blood test results, all your radiology results, and all your past discharge summaries. So it's a really useful database to go and search everything, and you'll use it every day on the wards. So there's two ways to search for a patient. You can put in your surname or some other information that you have about the patient. Or you can do a fast find and just put the X number into the corner. If you know their X number, that's probably the quickest way to do it. Once you've got the patient information, you can click on a number of different things down the side, which is going to give you different information. So probably the most important things that you're going to be looking at on a daily basis are your blood test results, so your pathology results, and that will come up with a list of all the results that they've had regarding their blood tests. So you can look at those either individually. So if you click on a result, then you can go in and see what your result is. And you can also look at a trend. So if you go to cumulative results, you can select a particular group of results. The most useful one that people use on the wards probably is going to be your gastroenterology profile. And click view. That will give you U's and E's, it will give you LFTs, and it will give you FBC and CRP. And then you can see the trend going back over time. Then you've got your radiology results. So this is going to link you to all your images. If there's a report, you click on your specific radiology result and it will bring up the report for the examination in a document. If you want to see the image itself, then you need to launch PACS and that will bring you up the image. Once you're in PACS, you can click on the image that you want to view from across the top, and then if you double click on the image itself, it will give you the image a little bit larger. Other things that are useful within Esearcher, you've got patient documents. This is where you'll find all your discharge summaries or all your referrals from different specialities. Particularly useful to find, obviously, if they've recently been discharged, what's been said about them before. So we've got a discharge summary. If you double click on it, it will open up the discharge summary. And then you've got endoscopy results if the patient's had previous endoscopies, and you can open up the results for their endoscopy, including the images on Endobase. You've got similar for cardiology, where you can review their cardiology results and their echocardiographies. And then you've got a link to the observation charts and vital pack data. Okay, so you can get all their use scores through the Esearcher system as well. Other important things or useful things, inpatient episodes, if you want to know how many times a patient's been in hospital recently, how frequently they attend, if they've got any appointments coming up, outpatient appointments. And then finally, just a bit of housekeeping, if you want to print off any labels for referrals or any investigations that you want to do, you can print the labels off from here. So some other useful functions across the top here, you've got your ward lists. If you don't know the patient's X number and you want to search for a patient on a particular ward, then click on ward list, drop down box, select your ward, and then it will come up with a list of the patients on that ward. And then you can select the patient the same way as you would otherwise. And then my lists. This is useful for weekend handover. So if you go to the drop down box, there's a number of different lists. The most useful one is if you're on the weekends and you want to know what patients you need to review for the weekend. The general medicine handover, select the correct date, and it will bring you up a list of all the patients that need to be reviewed along with a brief summary of what needs to be done. You can also add your patients to this list. So we're currently with our dummy patient, and if you just add selected patient, then you fill in who you want to review the patient, what ward you're on, and briefly a reason why you want them to be reviewed. Other useful things in my lists, previously reviewed patients. If you want to go back and see who you've reviewed, or you can't remember the name of the previous patient that you've reviewed, then you can find it in there. Esearcher is actually quite easy to use once you get used to it, but you will get some training on the wards when you're doing your shadowing time, and there's lots of opportunities to ask people to help you. There's the IT help desk that can also help you navigate your way through it.